So I put this slide in this morning at like 8:38 because we are going to be talking about wheat, and I guess I could have talked about it in lab, but I want to spend as much time in the kitchen today as possible. So, anyways, we left off talking about the factors that affect the development and strength of gluten, and I talked about hard wheat versus soft wheat. And how the hard wheat has more protein, the soft wheat has less protein. So the hard wheat is going to form more gluten. It's going to be chewier stuff like breads, pizza crust, whatever, bagels, that kind of thing. And then softer wheat is going to be pastries, cakes, crumbly stuff that doesn't have all that protein structure, those fibers, those protein fibers that we saw in the kneaded dough to help the dough stay together. So here's just a picture of a wheat berry. A wheat berry, or the kernel, aka the kernel of wheat, is broken into three general regions. Now there's actually, so there's the bran, the germ, and the endosperm. And each of these layers to a wheat berry has multiple layers that have been dissected for purpose and content and whatever. This is not that kind of a class. We're not going to go through that kind of detail. But I am going to talk about the bran, the germ, and the endosperm, because particularly the bran and the germ, these are terms that you run into in the grocery store. Like wheat bran, here's some wheat bran, or I'm going to go get some wheat germ and add it to my cereal or whatever. Right? You don't really hear about the endosperm as much, but the endosperm is the part of the wheat berry that is the most commonly encountered, however. So the bran is the outer covering of the wheat kernel. And the most distinct characteristic of the bran is how high in insoluble fiber it is. Insoluble what? Insoluble fiber. We are going to move on to carbohydrates next week. I might even run out of time, or run out of lecture here and talk about it at the end of the day. Probably not. But we will definitely talk about carbs on Monday, and we'll come to understand what insoluble fiber means. But it's basically just a complex carbohydrate that does not dissolve in water. You can call it roughage. Your grandma called it roughage. Yeah. It's high in insoluble fiber, which is so healthy for your gut, so healthy for your GI tract, and in fact your immune system and so many other parts of your body, your physiology. High in B-complex vitamins. We'll talk about what the vitamins are at a later date, hopefully in 2 or 3 weeks from now, I guess after spring break. And the bran, so when you hear whole wheat fiber is essentially, flour is essentially flour that has taken the entire wheat berry and ground it up into flour. And so the bran, the germ, and the endosperm are all in whole wheat. It is the whole wheat berry that goes into that flour. And so that includes the germ, which is the part in yellow in this diagram here. And the yellow is really, it's the embryo of a wheat plant. It's the part of the wheat plant that sprouts. So when you have, has anyone had like wheatgrass juice before? Right? Yeah, maybe. It's the germ that has sprouted into the actual grass that we are grinding up and drinking the juice of. So the bran is sort of the covering that keeps all this packaged. The germ is the embryo. And then the endosperm is essentially the rocket fuel for the germ, so to speak. All right, this is where the starch is. The starch is the repeating unit of glucose that serves as an energy source for the plant as the germ grows. And the endosperm is the part that makes white flour. So when you go to buy white flour rather than whole wheat, white flour is exclusively endosperm, and they've taken out the bran and the germ. They separated the bran and the germ from the endosperm when you're having white flour. So it's also where we find most of the glutenin and gliadin, the components of gluten. So there's a lot of protein in the endosperm as well. Also, you find B complex vitamins throughout the wheat berry, but there's certainly no lack of them in the endosperm as well. And then the other distinctive characteristic of the endosperm is this is where we find soluble fiber. These are complex carbohydrates, not the starch, other complex carbohydrates that are able to be dissolved in water. And so, for example, like when you take flax seeds, and we'll do this in the lab, but chia or flax seeds, you soak them in water for 10 minutes or something, and you go and you pick them up. They're like that slimy part of them. That's soluble fiber. It's fiber that is able to be suspended in water and is found in the endosperm. Okay, so that's a wheat berry. Let's keep trudging forward on the factors that build up gluten. So one of the things, when you talk to a bread maker, and one of the things they talk about is hitting optimal hydration, right? Like just getting the right amount of water in that flour to get the exact kind of gluten formation that they're looking for. So in this diagram here, you see this is the gliadin that has no hydration, right? Very low hydration. And the fibers just sort of lay next to each other. They're not really springy. It's not really stretchy. There are no loops in it. All right. There's close proximity, but there's no regular structure. It's sort of like, it's just sort of like pasta that's all laying next to one another. So then, if you begin to hydrate the mix of gliadin and glutenin, we begin to form this loop and train structure where portions of the strands will associate and form these trains, but then there will be big loops where the water is able to intercalate itself. You can see the water has formed itself into one of those loops and is giving the loop structure. It's those loops that form the stretchiness. When you are able to pull on those cables, those loops can compress and then come back into their shape. Yeah, Graham.
What is protein mobility?
Protein mobility. You're reading that on my slide. Reduces protein mobility. Yeah. So, if the protein isn't hydrated, you're not forming these loops, and you cannot stretch it. It's not stretchy because it doesn't have the loops in it. So imagine like a piece of wire that is just a piece of wire. Like you and I tugging on it, it wouldn't be stretchy. Whereas if we coiled it up into a spring and you had one end and I had the other, we could pull on it and it would stretch and come back to shape. Does that make sense? Yeah? Cool. So high hydration, you're going to have a really high loop to train ratio, right? And so depending upon the exact property that you want your dough to have, it's exquisitely dependent upon how much water you're going to use in that dough, right? And how it affects the loop to train ratio and the formation of the gluten microstructure. Okay. So some other factors, not just the amount of water, but properties of the water. What is the hardness of the water and the pH of the water? So, for example, calcium and magnesium are in hard water, and they tend to strengthen gluten, the gluten formation, the interaction between the individual strands in the gluten. Whereas water in Boston, for example, is very soft. It's very so it only has about 0 to 60 parts per million of calcium and magnesium. So it's not actually, it doesn't actually make quite the best bread. The water in Boston is not necessarily known for being the best tap water to make bread from. On the other hand, water in New York City is known as, the pizza from New York and bagels from New York are widely recognized as being exquisite, right? And what is it? Well, they say it's, there's the question, is it the Goldilocks water? The question was, is the water in New York City the Goldilocks water? Just meaning, is it just the right pH? Is it just the right hardness to make perfect pizza dough, to make perfect bagels? So before I answer that question, we'll talk about pH. Supposedly the ideal pH for gluten development is slightly acidic. So neutral water is 7. The pH of your blood is about 7.4. But the ideal pH for gluten is a little bit on the acidic side, between 5 and 6 somewhere. If you go above and below that, it's going to reduce the gluten strength and make easier to stretch dough. So, for example, adding baking soda. Often people add baking soda to their cookie dough, right? And that is going to make it more alkaline, make the pH higher, and it's going to make it's going to inhibit the gluten formation, make your cookie a little bit more crumbly or like crunchy rather than the like chewy. Right, and it's going to have a more porous, tender crumb. So that's why you put the baking soda in with those kinds of baked goods. When you put the baking soda in, it tends to inhibit gluten formation and make that more crumbly type of dough rather than the chewy dough like pizza or something like that, or a baguette. So what's up with New York water? Is it the Goldilocks water? So this guy, I know, I had really wanted to integrate this dude's book into the class, and I've done a poor job of it so far. But I don't know if anyone's looked at his book, the Food Lab book that I gave you. It's pretty interesting. J. Kenji Lopez Alt, in my aspirational class, we would be visiting the Food Lab down in Boston, where this guy has a life. But what he did is he wanted to know what's up with New York pizza and bagel crusts. And is it the water, like everybody says? Well, it turns out that New York does have a little bit kind of unusual water in terms of its hardness. But he took New York water, and then he took a range of other waters, bottled waters that had a wide range of hardness and softness, different mineral contents, everything from pure distilled water up to spring water like Evian and whatever. And he did a systematic double-blind taste test making pizza with these various waters. What is a double-blind test? Yeah.
So it's the people who are like tasting pizza don't know what they're receiving. People.
That's right. So he had some famous chef in New York, some famous pizza chef, made all the pizzas, was given the water in unlabeled bottles to make the pizza with. So that person didn't know the water they were using, made the pizzas all the same, and gave them to taste a panel of taste testers. And it turns out that the water in New York actually does not have a dramatic impact. And their conclusion was that it's actually the effect of the artisanal aspect of pizza and bagel making in New York. There's a lot of experience. If you know how to make a good bagel, you're going to make a good bagel. With what that's going to outweigh the effect of the water, was his conclusion. So I don't know. But we do know that pH and hardness do affect the quality of gluten formation. If you want to read more about that, it's in the introduction to that book. Did anyone read the story of that part in the book? Yeah. Some other aspects. So, the amount of time that the leavening of the bread, like how long you let the dough rise with the yeast in it. So these expanding air bubbles, the yeast is going to produce carbon dioxide as it's breaking the starch down in the bread. And that carbon, we're going to see that in lab today. We're going to have an experiment with yeast and various carbohydrates, and we're going to watch these lab gloves inflate, and we're going to measure the volume that's produced by them. And that expansion of the dough, that is kind of like, it's almost like kneading. It stretches the dough, it strengthens the gluten as the dough rises. The presence of different enzymes that are in the dough also have an effect on the strength of the gluten. So there are present, in any vegetable, whether it's a wheat berry, a carrot, a yam, whatever, there are going to be in that vegetable the necessary complement of enzymes that are required to break the nutrients in that food down, right? So when you think about a food, when you eat a food, your body is producing enzymes that break that food down, but presuming the food was not, if the food was raw, if you're eating a raw vegetable, there are also enzymes in that vegetable itself that can break the starches or proteins or whatever down in that vegetable itself. And so the question is, what are the enzymes what is the activity level of the enzymes naturally occurring in that particular flour? How active did they become when the flour was hydrated? Those enzymes are going to have an effect on the dough, and they're going to the specifics of those enzymes are going to have an effect on the texture of the crumb. So when you look at a piece of bread, there's the crust on the outside, and then the inside of the bread, the sort of doughy part on the inside, we call that the crumb. And the crumb is really some people are into crust, some people are into crumbs, some people haven't ever really thought about it. But some people like large open crumb with like big air bubbles. Some people like a finer crumb. The specific characteristics of the crumb are closely related to the enzyme profile in the dough. And then the last couple factors is the presence of salt. Salt is going to strengthen gluten, much like the hardness of water. Just like the calcium and magnesium in the water, the sodium that's in salt is also going to affect that. But salt, on the other hand, also slows down the yeast. Yeast don't really like being in a salty environment, and it slows down the rate of fermentation and the rise that you're going to get out of the dough. And then lastly is the addition of other things like fats, oils, sugar, emulsifiers, all kinds of stuff that you can stick in a dough. And they're going to have a range of effects, right? There are going to be these other chemicals that are going to interact with the gluten molecules and change the rate and type of gluten that's going to form. So, for example, various oils and fats or emulsifiers. An emulsifier, I haven't talked about emulsifiers yet. Well, maybe we'll talk about it during the lipid chapter. I did last year, but I might cut it. Emulsifiers are essentially kind of like detergents, edible detergents. They're part fat, part hydrophilic, and they're able to take fat and make it into tiny little droplets that can suspend in water. Right? So they're related to fats. Emulsifiers and fats can coat these proteins, particularly associating with the hydrophobic parts of the gliadin or the glutenin, and in so doing, they can inhibit the penetration of water into the protein structure, and we've already established that hydration is probably the number one factor driving gluten formation. Shortening, it actually shortens the gluten strands. It makes a more tender baked good. And sugar we'll learn this about carbohydrates next week, but carbohydrates really like to be hydrated. You all know how well sugar goes into solution when you stir it up. That sugar is competing for the water in the dough and can reduce hydration and change the characteristics of the gluten that may be forming. All right. Any questions on that list there? No? Sort of? Not at all? All right. Has anybody... I guess before I move on here, has anybody is anybody gluten-free in the room? Does anybody not eat gluten? No. Okay. Has anybody experienced anybody who's gluten-free? Or what is your experience with gluten-free? Okay, a lot of you. Tell me something. Tell me about it. Oh, you knew some people with celiac disease. Yeah. Yeah. And how do they, is it under control? How do they manage it?
Yeah.
Mm-hmm. Yeah, they avoid gluten. Yeah. Uh-huh.
They don't do anything. I don't know.
Sure, there is. Mm-hmm. Yeah, I mean, you'll see some statistics in a minute about the prevalence of celiacs and like occult versus diagnosed celiacs. Mm-hmm. That's the word. It doesn't mean witches. It just means not seen. Anybody else have anything they want to share? Yeah. She made herself gluten-free. Yeah. Was she a celiac, or she just wanted to stop gluten?
She just like stopped because she had stopped
Mm-hmm. 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 Anyone else have anything to share? Yeah. Mm-hmm. Oh. Hmm. Yeah. Yeah.
I know two people.
Mm-hmm. Mm-hmm. And did that bear itself out in their experience? What kind of injuries are we talking about, if I may ask? Okay. And who told them to not eat gluten? You had a story? No, one of you. Yeah, I mean, gluten has become a sort of trendy malady, I guess, would be the way I would describe it. Certainly, there are a lot of people with celiac disease. This range of stories you gave me, I think, is pretty indicative of the landscape around gluten. There are a lot of people with celiac disease who catch it at whatever point. Maybe the acute people catch it early in life. Some people are so severe they have to have, their own cutlery at barbecues or whatever. Some people didn't catch it until they were 40. Other people decided they had some sort of gastrointestinal distress and ascribed it to gluten, eliminated gluten, and it resolved, tried to add it back, and they had more bloating. And then we have like gluten and inflammation, in people who have an injury and they're told to not eat gluten. I think there is, what I'm going to offer you is that there's a range of pathology. There's a range of sort of truth and misconception out there. So for example, we'll get a chance to talk about FODMAPs, fermentable, I hope we will, I'll try to, fermentable oligo and disaccharides. These are sugars that often travel with gluten, but which are actually what are responsible for a lot of the symptoms of bloating and gastric distress that people have. So for example, if a person who is experiencing that were to eat a piece of seitan, for example, that is pure gluten, they may find that they're not actually, those symptoms don't actually come with that because they don't have the fermentable oligosaccharides that are causing the flora in their gut to produce a bunch of gas and give them the bloating that is so uncomfortable to them. Because gluten itself is not going to be something that's fermentable and produce a lot of gas. In terms of inflammation, and I want to say, I'm not giving you advice to give to your friends, any of you. That's not what this is. I'm not a medical doctor diagnosing a patient in front of me or something like that. But it is certainly the case that many people out there, even healthcare experts that are trying to help their patients, the people that they're dealing with, they're just going off the best information that they have. And a lot of our understanding of the way the body interacts with these various components in bread is still developing. And so the idea of gluten exacerbating inflammation in an otherwise healthy individual that has a knee injury, I'm not sure if that is fully based on the factual connection between the effect of gluten and inflammation in the body. I think that's something that's open to debate, is what I'm saying. But I don't know. It may be the case in these people. I'm just saying it's something that we'll try to explore a little bit. Graham?
Do you have an opinion on people who are just like gluten's bad, throw it out of their diet even though they have no real issue with it, they just use it as a scapegoat for their other medical problems?
Well, I mean, that's an inherently political question. I am not. I think 2/3 of the world protein comes from gluten, and so I think for a person to intrinsically demonize gluten is probably misunderstanding what gluten even really is. And what a cornerstone to the human diet it is. I think that I think everybody should make food choices and health choices that are good for them. And so if a person doesn't want to eat gluten because for whatever reason they don't want to eat gluten, they don't have to eat gluten. I completely support that choice. I think that's a great choice that they should make. I take issue with people making unsupported science claims, pseudo-scientific claims about the effects of gluten or not having gluten and what's actually happening in an individual. I think it's very hard often to parse out because nobody is eating exclusively gluten. And when you're eating a food, gluten travels with a lot of other compounds that are in that food. And it's often very hard to isolate individual physiology and components of individual diet. So does that answer the question? Food sovereignty. You should be able to eat whatever foods you feel are healthy.
I just had a question.
Yeah.
There's nothing like no acid.
Absolutely. No, you don't need gluten in your diet. It's just hard to avoid in our modern diet because gluten was, a staple. I mean, humans have been eating gluten since, prehistoric times. They've been harvesting grains and rice and whatever and eating that stuff for a very long time. Yeah.
Like obviously, like just
Well, you mean in a healthy individual? Yeah, I mean, what do you mean unhealthy? Do you mean like a diet of nothing but bread, or having bread as part of a balanced diet that has? Well, I mean that's a loaded question. So, is there anything healthy about having an excess amount of anything? Sure. I think that bread. I eat plenty of bread, and I think that bread is a fine component to a balanced diet. So, and I think that you can, not all breads are made the same. I tend to try to eat whole grain breads that can, whole wheat flour, and that can, where the flour is as minimally processed as possible. And if that is the case, you're getting much more of the nutritive component of the wheat berry. If you're eating a lot of bread that's like nothing but white flour, nothing but the starches, that has a really high glycemic index, which a glycemic, we'll talk about that, but glycemic index is just how rapidly a food that you eat spikes your blood sugar. Right? It's like how quickly your body's able to convert that meal into blood sugar. So white flour has a really high glycemic index. It spikes your blood sugar rapidly. You don't want to do that because that like messes with your pancreas and your insulin levels and all that. You want like a slow release of sugar into your blood, and that happens when you have a whole wheat, when your body has to work harder to get the nutrients out of the wheat berry. And the wheat berry is closer to the way our biochemistry evolved when we first started eating breads, which they didn't have, high efficiency mills that like would obliterate a wheat berry. It was like stone ground stuff out somewhere in a grassy plain, right? So very, very rough whole wheat was the first flour that people were eating. Does that make sense? Anyone else? All good questions. So all of that preamble was not to say that there are lots of pathologies associated with gliadin. So gliadin is the water-insoluble component of gluten. It's an interesting protein because it's actually, not only is it sort of hard to break down for the body, but it has the ability to cross the intestinal epithelium. It can be taken up as is by the cells in the intestinal lumen and not be broken down readily. Not every protein's like that. Most proteins are going to get broken down by trypsin and chymotrypsin and all these enzymes in your gut. And the amino acids will then be incorporated into the blood. But gliadin has the ability to pass relatively undegraded. So, for example, a mother who has a meal that is high in gluten, you can pick up the signal by isolating gliadin from the breast milk that the mother's producing. The mother's not making gliadin; she ate it. It's in her bloodstream. And one of the interesting things about that is that gliadin is actually used as an adjuvant for various biological pharmaceutical deliveries. So protein-based drugs that need to be delivered to the bloodstream, but are going to get broken down by your stomach, so you can't eat them. Well, you can conjugate them. In some instances, conjugate them to gliadin. You can eat it, and gliadin can help bring that protein into the body. Kind of an interesting thing. But there are essentially three types of pathologic responses to gliadin. You can have an allergic reaction. This is a hypersensitivity and a type of wheat allergy. All right, and so this is what you would call a non-celiac sensitivity to wheat, and this does happen. There are people who have wheat allergies out there. And then there is an autoimmune response. So this is celiac disease and a number of other ones. Dermatitis herpetiformis. There's gluten ataxia. So that's not fun. Gluten ataxia, these people essentially aren't able to walk. And what happens here is that the gliadin peptide, which is depicted on the right there, that peptide elicits an immune response in the person with celiac or any of these other problems. It elicits immune response, and it turns. I'm not going to go into depth about how the immune system works, but your body has. I'll just say that your body has the DNA to produce antibodies against essentially anything, including your own cells. But at birth, all the immune cells that target the self get turned off, get essentially killed or deleted from the population of immune cells in the body. But gliadin can cross-react with immune cells. It has enough of a presentation that looks like the self that it can start an autoimmune response in some people. And then your body starts making antibodies that target the self, right? And so we have wild inflammation in parts of the body, like celiac disease. Dermatitis herpetiformis is essentially like cold sores on your mouth, but like everywhere, real painful. And gluten ataxia, that's like a neurologic problem. I forgot to show the picture, the wheat allergy rash on the left-hand side. Maybe you've seen that rash on somebody before. Like often you see it on the backs of people's arms. People with wheat allergy will get on the backs of their arms, or sometimes on their face and forehead. Not from sugar, not from chocolate. This person's being good about all that, like a teenager. Not that kind of a rash. It's actually it can be a wheat allergy rash. It looks like that. And then there are this other category, immune-mediated gluten sensitivity, that can arise. So there's a spectrum of different types of reactions that happen to gliadin. Let's just look at celiac disease. This is the gnarly one. It can lead to a real degradation in the intestinal mucosa, in the intestinal lining. On the right, we see a healthy lumen, and there's all these big fingers that increase the surface area in your gut, and you can see they're quite stunted and malformed in a person with celiac disease, representing a high degree of inflammation and tissue degradation. So prior to 1970, they said that the prevalence was about 0.03%. That was pretty low. That was 3 out of every 10,000 people, right, had celiac, which is pretty low. But now they believe that the actual prevalence is anywhere from 0.5 to 1.26%, probably right around 1% of people in the United States and Europe. This is not just because of, this is probably because there are a number of cases that were occult prior to the 70s, and now our diagnostic technique is getting better. We can identify, this is celiac disease, where it wouldn't have been diagnosed prior. But there are other things that are driving the rise of gluten intolerance. So there are the genetic risk factors, but there are these environmental risk factors. So there's infant gluten exposure. So if you are like a 6-month-old baby and you get exposed to a huge dose, like say your first your first food is not avocado, which is a nice first food for a baby, but instead you get a big blast of gluten. That is correlated with gluten sensitivity as you get older. Socioeconomics. This is the one that is probably the most responsible for the rise in gluten sensitivity. So that is to say that the higher your income, the more hygienic your surrounding, the higher the incidence of gluten sensitivity. Right. So there have been a number of studies comparing people in Finland and Russia. I guess maybe we'll pick up with this on Monday. I'll finish gluten if you want. If you guys want me to finish this story, but let's end it there.